and let me know that there was an updated version or update, whatever. So they walked me through how to go into my settings and do the update, and now it's fine. So I don't know if you guys have tried that, the ones that have green screens, but they were really
But I
helpful.
will. I'm gonna try it.
Huh?
I said I'm gonna try it because it's horrible.
Yeah. Go in, call Zoom. I hesitated thinking, oh, I'll probably never get through. I was on hold for a little bit, but when I finally got through, they were able to walk me. They took me right to the settings. And of course, there was a little red circle that said one message, and clicked on that message, and it was a an update to the system, whatever. And boom, it's perfect now. So maybe some of you guys could try that. It's up to you. I don't even remember where I got the phone number. Oh, on your front of your Zoom page, I think it says contact us. Okay. So anyway, if everybody could turn on their cameras, that'd be great. Um, we got a lot of ground to cover today. I'm going to cover the content from last week, which was your exam, and then this week. Um, so I'm going to pull up your week 7 and week 8 notes, and we're going to go through those since that's a good summary, but still you're responsible for reading the pages in the book that are assigned for your week 7 and 8 reading. Don't take your notes as a kind of a be all end all. Just make sure you review your readings as well. Okay. Um, I have several people that don't have their cameras on. So if you guys could turn your cameras on, and if you could also put your name and your campus in the chat, I would appreciate that.
Marvel.
Yes.
I'm currently unable to put a camera on. Um, in 5 minutes, I can.
Yeah.
But
Why don't you, I think you're in the car, right? Are you in the car?
I didn't hear you.
Are you in the car? Yeah.
Yeah.
Why don't you get off
I'm
and then
home in
come?
4 minutes.
Okay. So just okay. Okay. So a couple of things. One is you guys got notice last week that the midterm evaluations are available in your shell. Um, so if you haven't already, if you could please complete those, that would help us. It would help me as your professor do a better job if I'm meeting or not meeting your needs. It would also help with curriculum for the PN community program, which I'm the course lead. So any information, any feedback would be helpful, both good feedback and constructive feedback. So I would encourage you to complete that. Let's see, I am in the process of meeting with several different students. Every slot got filled up this week, and then I've added like 8 different students. So I think I'm tutoring this week somewhere in the vicinity of 20 plus students. So if everybody that's needed to get in is in, either in one of the assigned slots I sent out on Saturday night, or I've added slots on Friday. So, and that's for students reaching out. So if you still want to review exam 1, 2, or both, please reach out to me. We'll get in, whether it's over the weekend or whatever. I've heard from a lot of students, but I've also not heard from a lot of students that I need to. So I'm encouraging you to reach out if you already haven't. I've already met with several students. I believe these one-on-one review sessions are helpful. We don't just talk about what happened on the exam. We talk about different strategies to attack the next exam, what questions are being missed and maybe why. So really encourage you to reach out. Okay, so feel free to send me an email if you still want to get together, and we'll figure out a time that works for both of us.
Hello.
Hi,
Sorry I'm
Amanda.
late. I was sitting in the wrong Zoom class waiting. I'm like, where is everybody?
That's okay. That's okay. Welcome. Welcome. Um, let's see. Oh, grading group projects. I'll be doing that today and tonight. So you should all have a grade in there for your group projects later on by this evening. I did look through several of them. They look great. I mean, they look great. Looks like you guys have done a phenomenal job on them. So, yeah. I know there were some groups that did have an issue with participation and communication. I am working individually with that. So I think I'm on top of that based on the communication that team members are sending me. So I'll be doing that today. I hope to have exam 3 study guide to you no later than tomorrow. I'm currently working on it. I do want to make some changes, some adjustments, add some information, take out some information. So just bear with me. Okay, you still have another week and a half. Actually, your exam would be 2 weeks from today. So if you have your exam study guide by tomorrow, you'll be okay. Okay, I've had a couple of emails about when it's going to be ready. As soon as I can get it done. Okay, I'm almost done. I'm probably 75% of the way done with it. So I should have that to you in the next 24 hours. Next week is review week. Next week in week 9 is review week for your exam 3. So you should have a copy of the review schedule. It was sent out in week 1. It was a master schedule with exams 1, 2, 3 review times by each professor, and then also the HESI review times, right? So next week, there's reviews. We also have class, and next week is the last week of content. Okay, so we still have next week with content, which is why the review sessions are in addition to. Okay, so just be mindful of those review sessions. I believe it's pretty much the same Monday, Wednesday, Friday. And then if any of you are having trouble with anything on the study guide or any concepts you don't understand, since you don't take the exam till Wednesday, 2 weeks from today, please reach out to me early in that week, Sunday, Monday, Tuesday, and schedule some time with me to review anything you don't understand or anything you want more help with. Okay? So please reach out to me for that if you need additional help before the exam. And so things are getting busy, right? As I told you at the beginning of the term. So this week we pretty much have lecture. What else do you guys have due this week? We're going to do quiz 5 today after we do the content. So that's all we have. Oh, no, wait. We're in week 8. Quiz 5. That's all we have today. Is quiz 5 for the week. So this would be a good week to be working on your HESI prep assignment that's due next week. Everybody, hopefully you've been filling that out. I've already had, I think, half a dozen students turn it in already. So hopefully you've been filling it out. It's due next week, next Sunday. And then week 10 is your exam and your vulnerable populations. So, and then you jump right into HESI. So it's getting busy. So time management, organizational skills are really, really key for you guys in the next couple of weeks. Okay. What else did I want to cover? If you're thinking about preparing for HESI, please be using your HESI study guide. That's what it's intended for. Okay. If you know and can articulate the topics in the HESI study guide, that's what's on HESI, at least from the last 2 terms. Those are the topics that are covered. I don't know the questions. I don't do the HESI. I don't know the questions, but I know the topics. So those are the topics, the last 2 HESIs that were asked about on your HESI study guide. Okay. So I know it seems like an overwhelming assignment. I get it, but that's your study guide. Okay. Does anybody have any questions? Okay, so even though I'm going to cover the notes, I still want you to preview the readings, okay? So last week, infectious control prevention and hang on, let's see, infectious control and prevention. So that was in your fundamentals book, pages 249 to 258. So you don't need to read the whole chapter. You just need to read those 9 pages. Okay. And then we did, you're responsible for all of chapter 41 and 44, patients with STDs and care of patients with bioterrorism attacks. I've kind of narrowed it down in your notes to, I think, anthrax and smallpox. So we'll talk about that. And then you had a Canvas reading about COVID-19. I wouldn't worry too much about that. It's more videos and just talking about COVID. There's not a whole lot of that you need to be responsible for, but please review it. And then this week was really kind of a med-surg week. You had the post-op care and then all the different chronic complex conditions, right? Cirrhosis, type 2, diabetes, peripheral artery disease, chronic venous insufficiency, hypertension, right? This week was mostly focused on chronic disease management. Okay. So does anybody have any questions before we get started? And then group projects, presentations. I think I'm going to have to bump that to next week. I tried this with my Monday class and we just didn't have time. Okay, because we had a lot of 2 weeks of content to cover and then we had quiz 5. So since we're done with quizzes after this week, I'm going to use my activity time next week to do our group presentations. Everybody okay with that?
Yeah.
Yes? Yeah. We just ran out of time and it's more important for me to cover content and this quiz this week. So we'll do our group presentations next week. All right. So I'm going to go ahead and share my screen.
Before we get started, do I just send you an email and ask you what time or day you're available in regards to like a
So
one-on-one?
how about this? How about this? At this point, why don't you just send me some days and times that you're available?
Okay,
Will that work?
that works. Yep.
Just send me what anybody's availability is. I can't do it today. Tomorrow I already have, I think 8 review sessions scheduled. Friday I do have some time late Friday afternoon, but I have a whole bunch of reviews in the middle of the day after I get done teaching. I teach Friday from 1 to 3. And then after that, I think I have review sessions from like 4 until 7. So if anybody wants to do later Friday night, possibly. This weekend, Saturday's I have stuff going on Saturday that's personal. My grandbaby Patrick, he's 10 months. We're heading to Chicago on Sunday. He has to have a hemispherectomy. Does anybody know what a hemispherectomy is? What's a hemispherectomy? Why might he need a hemispherectomy? Go back to peds. Anybody? What's a hemispherectomy?
Does it have anything to do with
It has to do with the brain.
Yes.
I was gonna say the brain. It's
Yep.
Something they removed.
What? So little Patrick had a perinatal stroke during delivery.
Oh,
Meh. So here's a little bit of peds for you. He had a little perinatal stroke during delivery and then developed infantile spasms. Anybody know what those are?
baby seizures.
Yeah.
Yeah.
It's
I
a
thought my
rare,
little-
yeah, it's a rare form of epilepsy. And it goes with a perinatal stroke. I know they're called infantile spasms, but what they are is seizures. They tried him a couple of different medications to stop the seizures. It happened on his right side. And in order to have the hemispherectomy, you had to break through both of your medications, which he finally has, meaning they're not controlled. So we are going to Chicago this weekend. The kids found this is their first baby. He's actually adorable. If you wouldn't really know there's much wrong with him unless you looked at his left side because he has left-sided weakness from the stroke. Anyway, they are doing a hemispherectomy. So what they're going to do is essentially just turn off the right side of his brain because 3 of the 4 lobes are damaged from the stroke. So they already think his left side is picking up quite a bit of function from the right side, and they're confident that this surgery will stop his seizures and then he can go forward. So it's a pretty, go figure. How about this one? The surgeon does this surgery endoscopically. Isn't that crazy?
Technology today instead of.
Okay, Jessica. Yeah. So keep us in your prayers. We leave Sunday. He has 3 days of testing.
Amen.
Yep, has 3 days he needs to have another PET scan, another MRI, and his surgery's next Thursday, the 9th. So yeah. So I don't know how I get into that. Oh, my schedule this weekend. So Sunday's a little bit iffy. I mean, I'm traveling. I'm only going from Denver to Chicago, but I should be available Sunday evening to do reviews if you want to schedule that. We leave in the morning, probably won't get settled till the afternoon. So Sunday evening I would be available for reviews. Okay? Okay, let's get going. Let's pull up our week 7. I'm pulling up the week 7 notes. That's what I'm doing. Okay, so in week 7, we covered disaster management. What role do we play in disasters? I mean, disasters happen all the time. There's 2 kinds of disasters. What are they? I don't know what kind of preparation you guys have done. So there's 2 kinds of disasters. What are they?
Natural and man-made.
Okay, give me some examples of a natural disaster.
Tornado,
Tsunami.
Hurricane.
Yep.
monsoon,
Okay. And the other kind of disaster that goes with natural are communicable disease epidemics. What are some examples of that?
Influenza. Is smallpox one?
Every flu pandemic.
Mhm. Yep.
polio,
Yep. Everybody thinks of disasters
Ebola.
kind of. Pardon me. Everybody thinks of natural disasters as earthquakes and tornadoes, but remember, communicable disease epidemics are
There's
part of
also-
that.
there's
What's a
also
what?
chemicals, biochemical, biohazard.
Well, hang on. What's a man-made disaster?
an oil
Caused
spill,
by human action.
Mm-hmm.
Warfare, terrorist attack,
Anthrax.
fires. What?
that's anthrax.
Yep. Yep. So there's natural and man-made. You need to be able to identify the differences of both of those. What are the 4 stages of disaster? I'll give you the first, prevention. What's the next phase of a disaster? Preparedness. Prevention, preparedness. Then you have your response. And then you have your recovery. Those are your 4 phases of a disaster. Let's talk about that for a minute. The expectation for nurses in the community and public health is that we can jump in at any point in any time during any of those 4 phases and participate. Give me some ideas of what we might do as community health nurses with regards to prevention.
Creating a disaster kit,
Education.
And
Mhm. Mhm. What about during the preparedness phase? What can we be doing? Or what would we maybe be asked to do? That's where the disaster kit comes in. We'll talk about that.
Probably separate by injury acuity or,
Well, that comes in the response, right?
okay,
When we're triaging, right?
okay.
So if you think about prevention, right? What can we do to prevent? Think about what we can do to prevent.
Like sandbags and
Reanimating.
stuff?
Yeah. Yeah. Preparedness,
Put the
prevention and
windows in.
preparedness are a lot, they
Lock
have a lot of
windows.
similarities.
Mm.
Mm-hmm.
Okay, those are-
Respond. Go ahead.
I'm sorry.
No, go ahead.
No, so would it be like covering doors and windows and putting sandbags, pretty much preparing yourself for what's coming?
Yep. And not so much personally, but this is how
Well,
you're preparing the community.
right.
Because remember, your job is to prepare the community.
Teach, right?
And we'll talk about this now. When teaching the family, we're going to teach them how to prepare a kit for a disaster. And I'm reading right off your notes here. You may be asked about this on exam. What's important to have? What's important part of preparation for your disaster kit? Couple things. Stock enough food for 3 days. Review the kit every 6 months. Make sure everybody knows where the kit is located. Another important preparation is make sure everybody knows where to turn off their utilities at the house. And why do we review the kit every 6 months? We make sure there's no expired items.
Also an escape rate of where everybody could meet if they get separated.
It's part of preparedness. Do you guys, do we know what the evacuation preparedness drill is in the schools? If you have kids in schools, do you know what the plan is at the school? If not, you should. Right? What's the evacuation drill for you? How do you have a family plan to reconvene everyone? There's a lot of things to think about. What if you have kids in daycare? What's their plan for evacuation and regrouping? A lot of things to think about. But as nurses, we're expected to participate in every part of a disaster. If we're part of response, we're going to be triaging. Who do you take care of first in a disaster?
Someone that has most severe injury.
That you assess is going to potentially
The one
survive.
that's gonna survive,
Survive.
survival expectancy.
Correct. Okay. Who are the least concerning in a disaster? What do we call them? The walking
deceased.
wounded.
Okay, I was gonna say the deceased because they're already gone.
Nope.
That's worry about
They're kind of,
good.
they're not even part of this triage plan if they're deceased, but you're taking care of the life-threatening that you are expected to survive all the way to the walking wounded. Okay, so you do need to prepare and understand the different phases of a disaster. Okay, please review the health. What channel is our disaster in? I think it's chapter 44 in the Med-Surg book. You do need to review the Healthy People 2030 objectives for disaster mitigation. Okay, because part of our role is preparing, alerting, and caring for clients with population, community. Right? We're caring, alerting, and preparing communities for a disaster. Right? So a couple of their objectives: increasing the proportion of crisis and emergency risk messages to protect the public. How are we communicating? Are there sirens? Is it a radio announcement? Oops. Do I have people cutting out here? Hang on. Let me get these guys in. Sorry.
Yeah, she's having a hard time getting back in.
Okay, no worries. She was in the waiting room. Okay. Um, what do you guys think we would be doing in the recovery phase as nurses? What are we doing? What could we be
Or they
doing?
haven't given you a restricted diet, huh?
Pardon me?
Trying to go back into the normal pattern of life of trying to get everybody in that state of mind.
Well, what about if you're assigned to a shelter for people that can't go back to their homes? What kinds of things might we do in a shelter?
Helping them adjust, finding them the resources to get help.
Exactly. Right? It may be clothes, it may be food banks, it may be medication, it may be diapers, right? It's all hands on deck. Has anybody ever been involved in an actual disaster in their community?
I have.
Okay, what was your role? What'd you do?
I was younger, and I was at my grandmother's house in Jamaica, and it was a hurricane. So we basically had to run and get into like one of the older houses that was on property, and we all huddled into the corner, kind of like shielded and everything. And before we did, we had like big pieces of like zinc sheets that we placed up against the walls and the windows in order to like keep ourselves barricaded and not get any water or anything inside the house.
Yeah.
And then after that, we before that, I noticed that my grandmother and my uncles and everybody, they all took the livestock and placed them into a barn along with the chickens and everything, and basically just tied down all the things that could like fly away, like the just like the garden and stuff things like that. So
Yeah.
that's what we did.
Yeah.
But I was young. I had to be like 5 or 6.
Yeah, very frightening experience. Why do we do everybody's employment should be doing disaster drills? I think that is a requirement now.
Yeah,
Have
we
you guys-
did it. We did it when I lived in Texas in the nursing
Yeah.
home
Yeah.
because of the tornadoes, and we were
Sure.
actually
Mhm,
in 2 of them in the facility that I worked at.
mhm.
One was bad.
So, right. So why do we have mass casualty exercises? What are we trying to evaluate?
Our readiness. And so we're not blindsided in case it happens, kind of like with the pandemic.
Mhm. Yeah, our readiness. What's the emergency response? How is it activated? How does the command center work? What is everybody's different roles? Whenever there's a disaster or a significant event, you always hear them talking about command centers. Right? Who's running the command center? How are they delegating tasks to everybody? There's one agency I'd like for you to be aware of. I mean, we know that FEMA does respond to disasters, and they have kind of the overall big picture of resources, personnel, right? But there's another agency. It's called the National Response Framework. Okay, it's right here in your notes, National Response Framework. And they provide specific needs to the community, namely transportation, temporary housing. I'm right here on your notes. Temporary housing, medical resources, search and rescue, and firefighting. So please be familiar with the national framework, National Response Framework. Okay? So that's all I really want you to know about disasters, knowing that, you know, the 4 phases of it, the prevention, the preparedness, the response, and the recovery. What kinds of roles might we play? Nurses play in those, all the way from preparing to response. Okay, you may be evacuating patients. Okay. The next topic is infectious disease. What do we remember about the epidemiological triangle? Do you guys remember that? Okay, so this is regards to infectious disease. We have what we call the epidemiological triangle. It has an agent. The triangle is the agent, the host, and the environment. Okay, The agent is whatever the bacteria, virus, chemical spill. Okay? The host is us. We're the ones who are infected. And then the environment is what's going on in the environment. Where are you? What kind of environmental factors will influence the agent infecting the host? I'm trying to explain this in simple terms. So let's take COVID, for example. COVID was the agent, right? We were the hosts. So as a host, many factors come into play. How old are we? What's our age? What's our gender? Which really didn't have much of an impact. Ethnicity, pre-existing conditions, immunological status, right? And then the environment. Where are we? Where were we when we were exposed? Were we in a hospital? Were we in a nursing home? Were we at home? Were we in school? So take the environment, the host factors, and the agent, and you have a lot of different scenarios, right? What I basically need you to know about this is the agent is the infectious agent. The host is person being infected, and the environment is where this all happens and how it impacts how sick somebody's going to get. How virulent is the agent? Is it a flu or is it a chemical spill? Is the host healthy? Not healthy? Are they old? Are they young? Okay. So some of the things that can affect the host, we already talked about immunological status, comorbidities, but factors, good nutrition, adequate rest, physical fitness, lack of underlying disease, good hygiene, that can all play in your favor, right? And then we have passive and acquired immunity. Passive is something that's passed on from the mom, from IV administered antibiotics. Acquired immunity to the disease from previous infection or vaccine. Think about COVID. Acquired immunity you have acquired immunity or natural immunity from either the vaccine or getting the COVID. Okay, there's two types of transmission. There's vertical transmission and horizontal transmission. Vertical is from a mother to her offspring. And then horizontal is person to person. Okay. Couple of conditions I want you to be aware of with regard to infectious diseases is hepatitis. What do we know about hepatitis? Is it viral or bacterial?
Viral.
Okay. What organ does it attack?
The liver.
Okay. How is it spread? Are there different kinds of hepatitis? Are there different kinds of hepatitis?
Yeah, A and E, they're spread through fecal and oral contact, and B, C, and D, they're bloodborne.
Okay. Okay. So that's all in your notes. You need to know the difference between hepatitis A, B, and C. Okay. What do we know about tuberculosis? How is it spread?
Airborne.
Yeah, yeah.
Mhm. What are some common populations we might see tuberculosis in?
Migrant workers,
Migrant
Homeless.
workers, homeless,
Homeless.
certainly the rural population. What about close living quarters?
close
Crowded
living
hou-
quarters. It could happen in nursing homes.
I was going to say that.
Yep.
Um,
Mhm. How do you test for TB?
a chest X-ray.
Before that,
TB time.
hmm? How do we
It's
test?
skin-
Skin test, right? So anybody had a TB test before they had to start work?
Yeah.
Yeah,
Yeah, work and school.
exactly.
Yeah.
Okay, so you need to have an understanding of TB, how it's transmitted, how is it diagnosed, and how is it treated? What do we know about smallpox? What's smallpox? You're going to get asked about smallpox and anthrax. Okay, so we have to, what's the difference? Anybody know the difference between smallpox and chickenpox?
I think smallpox, it affects your respiratory,
Mhm.
if I'm not mistaken.
What else do we know?
It was used as a weapon, as biochemical, well, as a weapon back in the day with Native Americans.
One of the biggest differences between smallpox and chickenpox is with smallpox, you're getting,
Smallpox, the lash leaf craters in the skin, whereas chickenpox, it just has the small red dots
okay,
that turn into blisters.
all right. And what about location? Where is it identifiable that smallpox may be present versus chickenpox?
Smallpox is on the trunk of the body only.
That's chickenpox.
That's chickenpox. I'm getting them.
Soles of the
Anthrax
feet.
is-
Soles of the feet. Okay, you don't get chickenpox on the soles of the feet, but you will get smallpox on the soles of the feet. That is one of the defining factors. Okay?
Can you repeat that again? Soles of the feet for smallpox?
Yeah.
Okay.
Yep.
Got them mixed up.
Yep. And then it usually spreads throughout the body within 24 hours. But you won't see chickenpox on the soles of the feet. Okay. What are we concerned about with regards to foodborne illness?
You should wash your hands before and after handling food and
Uh-huh.
separate raw and cooked meat.
Okay. Wash your hands before handling food. Separate raw and cooked food. Right? Separating your utensils and equipment. You're going to get asked about food safety on the exam. Thaw frozen food in the refrigerator, not the counter. Cooking food thoroughly. Do not eat hamburger, rare meat, and then do not eat food beyond its expiration date. What about waterborne illness? What usually happens? Something enters the water, right? Through animal, fecal, supplies, chemical plants. And what's common with waterborne illness? Cholera and giardia. Right? When you have disasters, maybe in underdeveloped countries, you always hear about outbreaks of cholera. Do you not? It's a waterborne pathogen and cause severe illness. And then we have vector-borne illnesses. We're still talking about infection control. We have vector-borne illnesses. What are those? An example is Lyme disease. What's Lyme?
Ear tick
Ticks.
bites.
Ticks. What about Zika virus? What's Zika virus?
Mosquitoes.
Mosquitoes. And then two other vector-borne diseases that are in your notes are Rocky Mountain spotted fever and malaria. So make sure you read about those. And then there's a section about HIV. What is it? Bloodborne infection spread through sexual contact, sharing of needles. And it can also be vertically transmitted through breast milk, pregnancy. We talked about, well, we didn't, but this is about your STDs. Chlamydia, gonorrhea. They bacterial or viral? You got to know the difference of which STDs are bacterial because those could be treated versus viral. They can't be treated. And with viral, it's simply symptom management. It's a chronic disease and it's symptom management. Bacterial, it can be treated. Okay, so with chlamydia and gonorrhea in particular, bacterial spread through sexual contact, treated with antibiotics. And if you're teaching clients that have either of these, you need to make sure you teach them that all sexual contact should stop until your treatment's completed. All sex partners for the last 60 days should be contacted, tested, and treated. And that you can be asymptomatic. And with women can cause PID, pelvic inflammatory disease, potentially lead to infertility, endometriosis, pelvic adhesions. And then we also need to know about syphilis. What do we know about syphilis? Is it bacterial or viral?
I feel like it's viral because it can
Viral.
become neurosyphilis.
It's actually bacterial, and it needs to be treated. It needs to be treated because syphilis is one of the more common STDs for a pregnant woman that, if not treated, has potential detrimental outcomes to the fetus. Okay. Another STD is herpes. That's viral, incurable. May start as blisters around the genitals or wherever the contact occurred. Okay, yes, you can take antivirals, but it's not curable. And it certainly can be passed on to the infant during birth, which is why somebody with a history of genital herpes will typically have a C-section. Right? We talked about hepatitis. We talked about tuberculosis. Okay, we know that STDs in general are a major public health challenge in the United States. Here's just a summary. Bacterial infections, gonorrhea, syphilis, chlamydia, they're cured with antibiotics. Okay, STDs caused by viruses can't be cured. Symptom management, lifetime of symptom management. And then we talked about syphilis, if untreated, can be transmitted transplacentally. Okay. Surveillance outbreaks. Let's talk about that. Why are nurses, why are we involved in well, first of all, what's an outbreak?
Like COVID.
Pardon me?
It's like COVID.
Okay.
It was an outbreak.
All right.
Or the flu.
Mm-hmm.
Right. So nurses are involved in surveillance all the time. As a school nurse for 20 years, I was involved in surveillance all the time. Okay, whether it was a parent calling in saying my kid has pertussis or measles or they have the influenza. Nurses are involved in observation and surveillance all the time. And then there's a difference between the two of them. And we need to understand the difference, right? What we do know is that observation and surveillance is an ongoing collection of data. Think of the nursing process here. Collection of data, analysis, interpretation, providing the information to whoever needs to know, and monitoring disease trends. Okay, so the difference is with regards to observation. Okay, observation is to essentially assess the health status of the public. Okay, we're trying to identify disease patterns, try and set priorities to utilize the resources that we might have, and then developing a plan for rapid response. Where surveillance, on the other hand, is used to reduce morbidity and mortality. All right, you're trying to control the spread of the disease. That's what surveillance is. Okay, a couple things we need to know about surveillance is there are a couple of surveillance systems that we will be using. Okay, we have a passive system and an active system. Those are the two most common. So a passive system is when something is reported to the health department. So as a school nurse, as a hospital employee, as a doctor's office, long-term care facility, work environment, the nurses report to the health department. Okay? Passive system relies on healthcare providers to report any existing cases. That's the passive system. And then the active system kicks in where the health department has to search for any additional cases by actively contracting providers. So, for example, let's say a hospital had 20 people come in with GI symptoms and they all ate at the same restaurant, and the hospital has reported that to the health department. Well, the health department now has to figure out who else is out there. Alert hospitals. Hey, we've had an outbreak at so-and-so hospital. Please let us know if you have any other patients come in. So then they're actively pursuing other cases. Okay, those are the most common two. There's two other ones, the Sentinel system and the syndromic system, which is right in this paragraph. But you're going to be asked, you're going to be given a scenario and asked, is this a passive or active? Should use is this an example of passive surveillance or active surveillance? The other thing that's important is patterns of occurrence. How did this happen? Okay, we need to think about what was the pattern that happened when we're investigating the outbreak. Two most common are a point source outbreak. And this again, right here on your notes. Point source outbreak. Everything happens to the group of people at the same time and everybody gets sick. I always say like a chemical release in a train. Everybody's exposed, everybody gets sick. Whereas an intermittent outbreak, let's say you're at a restaurant and there was food poisoning. People are going to get sick at different times depending on when they ate it. Did they eat it for breakfast? Did they eat it for dinner? And they may get sick that day or the next day. That's intermittent. Okay. Then there's another pattern that's called a mixed outbreak. Okay, so somebody's exposed and then it's person-to-person contact. So like the flu or COVID. So COVID would be a mixed outbreak. One person exposed, then they pass it on to someone else. COVID, flu. Then the last one is a propagated outcome. There's no common source, and it spreads gradually from person to person. An example of that would be TB. Okay. So surveillance systems, we need to be able to identify your active and your passive, your patterns of occurrence, you need to be able to identify. If you're given a scenario of something, is this a point source? Is this a intermittent? Is this a propagated occurrence? Or is this a mixed occurrence? Okay, then the third thing about surveillance is one of the very first things you have to do is conduct a needs assessment. What does the community need with regards to this outbreak? There's a couple of stages that we have to go through when we're conducting a needs assessment. I'm going to have you guys read this on your own. There's a pre-active stage. There's a reactive stage. So a lot of the information in this surveillance observation chapter is definitions. Okay, so there's a reactive, pre-active, reactive, inactive, and then an interactive. Just know the difference between the four of them. Okay, so for example, pre-active stage is you're considered to be projecting future needs. During a reactive stage, you're trying to identify what was the problem based on past identified needs. And the inactive stage defines the problem based on existing health status. So I don't want to, this can get pretty confusing, so I'm trying to keep it simple. So here's the three right here. All right, this first, in your notes, this first paragraph talks about the difference between observation and surveillance. Second paragraph talks about your few surveillance systems. Third paragraph talks about your patterns of occurrence. And then this talks about how do we do a needs assessment and what are the 4 stages of a needs assessment. Okay. So that we covered infection control, HIV, TB, STDs, bioterrorism, and disaster. Let me go back up here because here's what you need to know about bioterrorism. I'm asking you to know about anthrax right here and smallpox. And I'm asking you to know just what's on here. What is anthrax? What is smallpox? Okay. So that's week 7. This shouldn't take us too long to go through because I'm not covering all the different chronic diseases. You guys can go through that. What's home health? When you think about home health, what's home health?
Healthcare at home.
Yeah. Where would patients prefer to be treated?
Home.
At home.
Why?
It's their safe
they're-
place.
Yeah.
Comfort, privacy.
Okay. What are some of the 10 years ago, most of our care was provided in the hospital setting. What are we doing in the home? What are we doing in the home setting that is drastically different? What allows patients to go home earlier? What can we do?
Provide nursing services.
Like what?
Physical
a
therapy.
visit- Visiting
Yeah, you-
nurses.
You got your home health aides.
Training, how to change a wound, IV meds, right? Peripheral meds, medication management, training, education, fall prevention. We talked about all different kinds of assessments we do in the community, from a safety assessment to a family assessment to a environmental assessment. All that can be done in the community now. Patients prefer to be in their home if possible. Okay? We can do a lot of care in the community now based on telehealth. Not having to go into the doctor's office, doing phone appointments. So the what I'm trying to get at is home health has emerged. It's emerging all the time. Even in the schools, things I would have thought we would never do in the schools. Last couple of years before I retired, I think I've told you before, in the schools we were taking care of kids with diabetes, doing insulin pumps, doing insulin injections, suctioning trachs, cathing, female students, male students, emergency seizure medication administration. So a lot of our community care is transitioned from the hospital setting. Okay. Case management. What's a case manager? What does a case manager do?
You pretty much manage the patient. When they go home, she's responsible for making sure that they have the care that they need. That they need PT/OT. They make sure they have the orders. They do the patient teaching. I mean, they pretty much the eyes and ears for that patient.
Excellent, Elfreda. Thank you very much. You're the coordinator of care. Nurses are case managers all the time, whether you have the title or not. You're always case managing. If you have a patient that's going home, yes, if you have a case management department and the case manager is helping you work on that, that's fine. But what are they responsible for? People might need, like Alfreda said, they may need PT, OT. They may need medication management. They may need Meals on Wheels. They may need home equipment, oxygen. They may they may need somebody to get in there and help teach the family how to change a dressing, how to administer antibiotics. So a case manager is the coordinator of care. She's communicating with numerous healthcare people to try and provide a seamless transition from an inpatient setting, wherever that may be, to the home setting. Case manager is one of the most important roles as nurses. It really is. We could be an educator. We could be a direct patient caregiver. We could be the counselor, the resource, kind of the resource bank. There's lots of different hats the case manager wears, and depending on your facility and what services your patients need. Like I had to work with a case manager a couple of years ago when Tom had a emergency triple bypass. And there were lots of things that we needed to consider before we went home. There was a case manager that worked with us at the hospital that had a checklist. Everything we needed to have in place at home before he could be discharged. All right. Cardiac rehab appointments, physical therapy, home oxygen. Case manager did all that, coordinated all that. And then community resources. If we are going to be a community health nurse, public health nurse, we need to have a really good knowledge base on what community resources are available. Whether the community resources to help clients with self-care, resources to help them manage chronic illnesses, reduce vulnerability. Do they need food? Do they need shelter? Do they need Red Cross, food banks, clothing banks? What about teen pregnant moms? Do they have crisis centers for those in need? Are there domestic abuse shelters, transportation services, sitter services? Think of all the resources that the community will need to support moving lots of care from the hospital to the home. Right? So we as community nurses need to be kind of the resource bank. You may not know everything off the top of your head, but for example, when I was in school nursing, I had a binder that I just kept collecting information of resources. As I would refer a family here, something else would come up. And then I'd get that information, put it in my bank of resources. So when families, kids needed resources, parents needed resources, I considered myself very resourceful. And if I didn't know the answer, I'd find out for them. Okay. The rest of your notes, I'm going to have you guys go through. Okay. This then goes through your complex chronic illnesses. Okay. And it goes through each of them that we talk about. Your post-op care. And it breaks down each section with nursing process, with assessment, with planning, with intervention. Okay, so it goes through post-op care, goes through cirrhosis, COPD, type 2 diabetes, peripheral artery disease, CVI, and hypertension. Okay, so this is, you can go through and highlight these, I guess, if you would like to, but it goes through each of these. And let me tell you, there's going to be a question or two asked on every one of these. Okay, so be aware of these. Okay, in the study guide, I have shortened it up. Okay, but I want you to go through this section. This is a very detailed section of, let's see, 2, 4, 5 chronic complex health diseases, and it goes through post-op. All right. So this is detailed. I want you to read through all this. And then when you get the study guide, you're going to see an abbreviated section of these. Okay. And I'm sure you've been introduced to all this, right? In your med-surg. You've been introduced to all these chronic complex conditions, correct? So it might be a refresher, but remember, we're community nurses, we're med-surg nurses. We're taking the care from the inpatient setting and moving it into the community, which includes med-surg. A lot of med-surg, actually. Right? So week 8 is very, I hate to say it, but med-surgy. Okay? Where we're going through chronic conditions. Why are we going through chronic conditions? Why chronic conditions? Why do we pick that to go through?
Because the care is long-term and community focused.
Well, and because people are living, in addition, people are living longer. And so the increase in chronic diseases
Is larger.
is huge. That's what most of our care in the community is. If we're not doing patient education and patient teaching and programs, we're caring for patients with long-term chronic diseases. Would you guys agree? So that's why this is all focused, these numerous complex chronic conditions are focused on this week, because the majority of our care in the community is chronic care. Okay. So read your last 2 weeks of notes, especially these med-surg complex chronic illnesses. And if you look in your readings for this week, each of them just has a few pages in the chapter. The chapters are all over the place, but each of them has I don't know, cirrhosis, page 726 to 730. That's all I want you to read. I don't want you to read all the pages before and pages after, whatever chapter it is. Okay, same with type 2 diabetes. Page 882 to 902. That's all I want you to read. So don't go above and beyond the assigned readings. Okay? Focus on the pages assigned to you. That's it. Otherwise, you're going to be reading 15 chapters this week, and we don't need to do that. Okay? Okay, questions about content. We get everything covered? Home care, community resources, case management, care of chronic. Okay, so we've covered week 7 and week 8. I know it's an overview, but you have notes to support that. You're going to be getting a study guide here in the next 24 to 36 hours. Be mindful of your readings. As for many, many of these topics, it's a very limited amount of reading in chapters. Okay. Let's have everybody pull up your quiz 5. And I want you to take quiz 5. Okay, I'm going to give you 10 minutes, 9 minutes. It's 4:05. We're going to come back at 4:15 and we'll spend the last 15 minutes going through the quiz. So I want everybody to take quiz 9, please. And if you've been paying attention today, it should be a no-brainer. I'm going to mute myself so I don't keep talking. So I'll see you in 10 minutes. Okay, I don't see a lot of people that have submitted the quiz. You guys all still working on it? You need a few more minutes? Okay. How about 5 more minutes? Okay. Once you're done, submit it and then we'll go over it. Okay, about 2 more minutes and then we need to get going reviewing this, okay? So if everybody could submit it in the next couple of minutes when you're done. We only have about half the people that have submitted it so far.
Did everybody submit? If so, I have a question, Professor Marvel.
Sure. Let me just go through. I have Karen, I don't have yours. Dwayne, I don't have yours. Renaya, I don't have yours. Gail, I don't have yours. And Yolanda, I don't have yours. Go ahead, Danny.
So for the pregnant person with the vaccination,
Mhm,
An MMR is actually one shot. So measles, mumps, and rubella is one shot.
mhm.
But the answer choices were rubella and measles.
Okay, so just answer it as the question asks you. It doesn't talk about a combination of shots.
No, but the rubella shot is one shot. That's the MMR. It's only one shot. Know what I mean?
And with that, you
With
can't
the-
give pregnant people live vaccines, correct?
Correct.
Oh, so the measles version of is the live version and the rubella is the inactive. Okay, got it.
Correct. All right, is everybody submitted? I don't wanna, I wanna have time to go through it. Has Karen, have you submitted it? Who else didn't submit? Yolanda, did you submit? Okay. Let me do one last check here, see who we're missing.
Mine should be there. I think it's just loading.
Okay. Let's see. Yeah, I think I have everybody. Karen is the only one I don't have. Where's Karen? Karen, are you there? You see your wall? I'll ask her to submit it when she gets back. Okay. Let me share my screen. Okay, let's go through question one. School nurse notes several children, and you guys know what questions you got wrong, correct?
Yes.
Okay.
Yes.
Yeah.
Karen, are you back? School nurse Karen, can you submit your quiz, please? Thank you. School nurse notes several children developing a pustular rash on their faces and extremities following several days of fever and malaise. Which steps should the nurse take next?
Notify the authorities of potential smallpox in the school.
Yep, and that's right in your notes. Okay. Pustular rash on their faces, extremities, several days of fever and malaise. Okay, that's the first thing you do. Okay, is notify the authorities of potential smallpox. Question two, I think this is the question Danny was asking about. Nurse is caring for an immigrant who's pregnant with their first child. There are no vaccine records available. Which vaccine should be prioritized?
The
Okay, so for
rubella
this
because
one,
it's
I
not
was
active.
confused about this one because we were always taught that an MMR you can give a pregnant woman until after birth. So I didn't
Exactly.
pick rubella. I picked influenza. That's why I didn't pick that.
So did I. I didn't pick anything when it came to rubella either.
So I
Because
was
they
confused
stressed
about
it
that
to
one.
us. They stressed this to us they should not get.
'Cause it's
But they
about-
can get the flu.
Yes,
But
I would.
they can
Off-
get they can get the rubella shot without it being part of an MMR.
That's what got me. I
I
thought it was
thought
all
that,
one shot.
So
the
that was
rubella was
tricky because
a
I
live one as
just,
well.
yeah,
Say
so
that-
like I
hang
didn't
on.
think that way. I just went
Yeah.
with what we were always
Well,
taught.
nowhere on the four answers did it say MMR. It actually split them out. That's why it's split out.
I thought it was a
Yeah.
trick question.
No.
Yeah, I understand
always
that, but
thought
like
that,
I've always seen it. I didn't think of it as split up. That's why it confused me.
Well, yeah, so nowhere on here do you see MMR. If you had seen MMR, that would be obviously no, but you can give the rubella. Why?
I just thought the rubella was live as well with
Yeah, same.
Yep.
I didn't know it was
And
it
it's
was
separated.
inactive. I didn't know.
I didn't know it could be separated. Sorry.
Yeah, same.
Yeah, it can. The health department is caring for a 16-year-old female with a new diagnosis of gonorrhea. Which education should the nurse provide?
Pelvic pain and fever.
Right. Why is that the right answer?
Because that means that there's a problem if they got that PID shuffle.
Exactly. If she's already been diagnosed with gonorrhea, Part of the follow-up is, part of the teaching is pelvic or abdominal pain. Okay. Number 4, occupational health nurse is caring for a client who just sustained a needle stick injury at work. What education should the nurse provide regarding HIV testing?
Return
in
for
3 months,
another in 3 months.
Why?
because you can get false negatives.
The
Yep.
first 3 months, you can get false negatives. Exactly. Exactly. And again, this information's in your notes, your weekly notes. The nurse is developing a primary prevention program for tuberculosis. Which intervention is appropriate?
Reduce the crowded living space.
Right? Everybody understand
Everything
that?
else is either tertiary or secondary.
Exactly. Exactly. Everybody understand that?
Yeah, I was rushing, thinking I had no time, and all I said, I read discuss, and I just hit it. So,
Yeah.
yeah.
One of the high-risk areas for contracting TB is in crowded living conditions, especially in homeless shelters. Okay, so question 6, the home health nurse is visiting a client recovering from a right hip replacement that was done a week ago, 8 days ago. The client is complaining of calf pain in the left leg. Which nursing intervention is a priority? Remember that word priority.
Following the symptoms, we're assessing the left calf for edema because it could be
What
A
could it
clot.
potentially be? A
a blood
clot.
clot.
Yeah, especially after 8 days. Right? Question 7, the home health nurse is caring for a client with chronic peripheral arterial disease in both legs. Which client education should be included?
Stop
Stop
smoking.
smoking.
Yep. Anybody have a different answer?
I put position a pillow under the knees while in bed.
Okay.
I chose elevate legs.
Okay.
I misread the question completely.
Okay.
I almost went with stop smoking, but then I second guessed and I chose differently.
Well, the whole issue with chronic peripheral arterial disease is blood flow, right?
Yeah, I get that. I understand why it's right. I just told
Mm.
me why I changed.
Okay.
That's why I chose elevate your legs, but then again, smoking does constrict your arteries and your veins, so there it is.
Mhm. So these questions are these are assessment of patients. So this is taking your knowledge and putting it into practice. Which dietary modifications should be used by a client with COPD?
Rest.
Yeah,
Before starting a meal.
what happens with COPD patients?
They run out of rest.
Exertion.
Exertion, they're fatigued easily. You're certainly not going to do number 1. You're certainly not going to do number 4. Right? So resting before they eat a meal. The home health nurse is caring for a client with cirrhosis who lives alone. Which intervention is a priority?
The fall risk.
Yeah, absolutely. I mean, all the other, this is a good example of a question where you look at it and say, well, geez, all of these look okay. But then what do you need to do if they all look okay and you can only pick one answer?
Safety.
See, you go back and look at the question and see if you missed a word and it was priority. Obviously, safety is the priority. Once you've done your safety assessment, then you can start working with the other 3. Okay, which food should be avoided by a client with poorly controlled hypertension?
Canned soup.
Why?
high in sodium.
Yeah. Did anybody get that one wrong?
Mm-mm.
Okay. Did everybody turn their cameras off?
No, I think you turned yours on. I don't see
No,
you.
mine's on.
Okay. I only see Dwayne. Hey, Dwayne.
I can't see you or your screen.
You can't? Oh.
You just popped back
See
up for me. You were
everybody.
off.
I should
I
be
see everybody
there.
else too.
I can only see Dwayne, but that's okay. We're all done
Wow.
anyway. That's okay.
Yeah, we're all here.
Okay. Hi,
Yep.
everybody.
I'm here.
All right. So, how'd you do in the quiz?
Mm.
Mm.
I did horrible.
So why did you do horrible?
Mm-mm.
Were you?
I changed
It
2
was that
answers and
MMR.
then
Red.
I changed a lot of my answers.
Okay. Well,
It was the
okay.
vaccination for me.
Don't make. Where's Danny? I can't see Danny yet.
Uh,
Danny,
I'm here.
come on, man.
We talked about this yesterday.
What did we talk about yesterday?
We talked about this. We
I'm
did.
hearing of all of you that just said you changed your answers. Come on.
Yeah.
I am very bad for that.
Well-
I second guess myself.
She talking to you about this?
Danny can inform your group, okay? What we talked about yesterday. Right, Danny?
Go
We had a
ahead,
good
Danny.
conversation. It was very good.
Yeah, we had
Follow
a great
your gut.
conversation.
God
Follow
is in
your
your gut.
gut.
Follow your gut.
Nurses have a good gut. Nurses have a good intuition.
Mhm.
Follow your gut. You got to be able to convince yourself why you changed your answer, why it's absolutely concrete, black and white, that you absolutely picked the wrong answer. Like you accidentally chose A instead of B. You clicked it wrong. Right?
Well,
That's
there is one that I did click wrong. When we were going over it, I'm like, that's not what I clicked. It moved down on me one. That's only on one though, but a lot of the other ones I changed. Yeah.
all right.
C'est la vie.
Okay, so we are done with week 8. We've got one more week of content. You'll get the study guide soon. And then please be